Okay, so we're going to look at EOS scan, which will scan from the head all the way down to the feet. It is a very low dose X-ray, and it's designed, or it was designed for people to have, constant X-rays without sort of the amount of radiation exposure. But in saying that, it gives great detail. So, for example, even if you want to look at the knee joint, we're able to zoom in and look at the actual knee joint. If we need to look at other areas, for example, the hip, where are we? Want to zoom in, we can actually also see the hip joint. At the same time, we get a lot of measurements too that can actually help in regards to not just leg length, but the position of the pelvis and so forth. So this is primarily what we use it for, is the leg length difference. So as you can see here, what they've done is they've measured the femur, right, and at the same time they've measured the length of the tibia, and they've given the position of the lower leg, be it in either varus or the varus position, or tibial varum position of the actual leg, which I'll explain what that means. So what you get is a report, and you get also details in the actual scan. So what this shows here, so I want to go on to the next slide. It gives us the femur lengths of the right and left, tibia length of the right and left, and it gives us the functional leg length and the what we call obviously the structural leg length, right? Now, what is the difference between these two? One is including the position of the knee, or the joint of the knee. If we look back here, all right, so one of them will give you the position of the actual knee. So that's the functional, they consider that to be functional. So from the tibia all the way down to the ankle, including the knee. While the other one is just the femur and the tibia added together. So it's eliminating. So if someone's got osteoarthritis in the knee, then that's going to affect the obviously the functional leg length compared to the whole or the structural leg length. I'm not sure why they're using the word functional leg length. Functional leg length is more towards sort of muscular. I think the reason they refer to it as functional because they're considering the tissue of the actual knee. I'm not sure, but pretty much you get two separate measurements. Okay. And you can see the angles of those measurements are different because, like I said, one's going from the hip to the ankle, the other one's just doing the tibia and fibula separate. The best way, to be honest with you, is take both those measurements, and that will sort of give you, most of the times they're pretty close anyway, but that will sort of give you an idea what the leg length would be. Okay, so with the functional leg length, but again, we use the word functional to mean a leg length caused by muscular imbalance, but here they've used it to include the actual knee joint. It's saying that there's a leg length difference, so between the right and the left, the right leg is shorter by 8 millimeters or 0.8 centimeters. All right. If you look at the anatomical leg length, or what we consider as the structural leg length, it's the same. Okay, so we've also got 8 millimeter difference between the right and left. Like I said, generally these two you don't find too much, only like 1, 2, 3 mil difference. If you do find more of a difference, check the scan. Sometimes the points that they've taken the length, sometimes they haven't pinpointed exactly, for example, the hip to the knee or hip to the ankle, so you want to double check that. So that's very important. Okay, so this is telling us the patient has a leg length difference of 8 millimeters shorter on the actual right. They'll give you some other measurements, like for example the femoral head diameter, which is good. Other measurements they'll give you is the varus position, which is also very important. So the right is a 7 degree and the left is 4 degrees. So again, if you go back to the actual scan, so let's see if we can zoom back to the actual scan, we're talking about this position here, and you can see that on the right, yes, it is about, say, 7 degrees. All right, and you can see that position is greater than the left, and we're talking about this angle here, from here to here, how much that angle is actually rotating outwards. All right, so that's what it'll give you in regards to the lower limb. Now, at the same time, it will also assess the back. So if we look at the other scan, all right, that's a scan. It will give us the position of the back. And if you look at this patient here, as we see, there's a curvature. All right, there's a scoliosis of the back. Right, it actually appears a lot worse on the normal scan. All right, but you can see what's happening with the back here, coming in one direction. So he's got, again, there could be a muscular imbalance, because an 8 millimeter difference won't cause that much curvature of the actual back. So there must be a functional part, or a muscular imbalance, tightness, whatever, causing this type of or this amount of scoliosis. Right? So that's from the front. From the side, there is a lack of kyphosis and a lack of lordosis too. So you're not seeing a nice curvature. All right. Now, as a podiatrist, we don't necessarily just look at these images and treat the patient, because this is an upper body thing, only if it's related to the leg length. However, most of the patients that have these issues are already seeing a physio, an osteo, or a chiro. And normally what I do is I get these pictures and measurements and I forward them on to the physio, the osteo, or the chiro, anyone that's treating the patient, for them to have a view of what's happening to the actual patient. All right, but it's good information to have, because it's tying the mechanics of the body together. And yes, sometimes it is related to the position of the actual legs. All right. Also, most important, what we consider is pelvic tilt, because that shows us muscles that are attached to the leg, how much they're pulling down on the actual pelvis. So anterior pelvic tilt. So here we've got, say, 10 degrees of anterior pelvic tilt. All right, and what also helps is the inclination, right, of how much the pelvis is tilted. All right, so that gives us a little bit of information too. All right, so that's good information for us to have. Something that I find very important to understand and to also benefit in the way of treatment, also showing how the patient's gait is the plump line. All right, that shows how far the head is away from the midline of the body, and for this patient, it's showing 43 millimeters. All right, which is actually more than what it's supposed to be. All right, but it gives you some readings there of the actual spine. Again, people that focus more on treatment of the back, this information is very important to them. Okay, and then sometimes they give you a little bit more graphs, a little bit more information, but generally for the EOS scan, that's what we get. All right, and at the same time, like I said, we're able to zoom in, and so we can have a look at the hip position, and we've found many kids, for example, that have hip dysplasia. So you can zoom in, have a good look at the actual knee, say a little bit of spurring there. So this person's got a little bit of medial knee arthritis. Okay, so if I want to investigate further, I might send for x-ray at different angles. Again, there, same thing, medial knee arthritis, a bit of spurring top and bottom. All right, at the same time, you can scroll down and have a look at the ankle joint. All right, unfortunately, it doesn't give good x-rays or good images of the actual feet. It's all cluttered, but it gives you a sort of a nice look at the actual ankle joint. And so that's what, as a podiatrist, what we would probably use it for. Let's just look at the side angle if we can, without any drawings. Sometimes what they do, and you can't see this here, but sometimes what they do is during the scan they'll put one leg in front of the other. All right, generally they shouldn't, but sometimes they do, and that will show a little bit of what's happening on the knee. But you can see a little bit of spurring there, so there's a bit of arthritis going on in the. But what I find that very beneficial for is when you're looking at the hips, especially in children. So when you're looking at children, when you're looking at the hips, you can tell if there's hip dysplasia. And I'll see if I can pull up an example of someone. So here's a patient, a child, and they were walking on their tiptoes. All right, and you can see they've actually flagged it here. Okay, they've actually flagged it, and they've actually measured, and they've realized that there's hip dysplasia, and this one was actually referred to a pediatric orthopedic surgeon for surgery. And if you click on the actual report, so we go to reports, I don't know if you can see, but it would mention here that there is hip dysplasia. Okay, and further tests need to be carried out. So yeah, that's generally what a leg length scan involves. With this one, we did order some full x-rays too. They came in the same file, but that's separate. But in saying that, with the EOS scan, it's very good tool. So you're able to measure the patient, see their spine position, see their leg length difference, And like I said, a very low dose or amount of X-ray is covered under Medicare, and that benefits the patient a lot.